Hi all, welcome to the second in a series of videos regarding the Knights Pharmacy and Medinova partnership. Today, we are going to be focusing on the process. So let's just recap the patient journey. The pharmacy identifies the patient in store. This could be as a result of the patient coming in and seeing the posters out on the shop floor, or perhaps because the patient's tried everything and they want something different. The pharmacy then asks the patient whether they would like to be contacted by Medinova. This consent form is not to participate in the clinical trial, but to be contacted by Medinova. And finally, the patient is contacted by Medinova and a patient visit is booked. So your pharmacy will be receiving window posters, a counter-struck card, and 100 pharmacy consent forms. There will also be 200 pharmacy-specific stickers. These are very important for two reasons. Firstly, we know where the patient has been referred from, and secondly, so that the pharmacy can be remunerated accordingly. There will also be free post envelopes. Now, there won't be enough for each consent form, so you'll need to be sending the consent forms off on a weekly basis. The clinical trial currently being recruited for is atopic dermatitis. This is a phase 3 randomized double-blinded placebo-controlled trial in adult subjects with a history of topical therapy and moderate to severe atopic dermatitis. We'll go into the inclusion criteria and exclusion criteria in the next slide. In terms of all the inclusion and exclusion criteria, this will be dealt with in the phone call that the Medinova research have with the patient. In terms of the main inclusion and exclusion criteria, they are as follows. The patient would have to have a clinical diagnosis of chronic or long-term atopic dermatitis for at least 1 year. Within the last 6 months, they would have had to try various products with an inadequate response to treatment. They would have to be over 18 years of age, and when inflamed, the condition could reach up to 6% of the body's surface, which is 6 hands worth. The main exclusion criteria is that the patient is a cancer patient. So cancer patients are not allowed to take part in the study. So just to recap, the consent form here is for the patient to be contacted by Medinova Research and not to participate in the clinical trial. Once the consent form is filled and sent over to Medinova Research, Medinova will then contact the patient directly, go through the inclusion and exclusion criteria, and will contact the patient with regards to a patient visit. The pharmacy-specific sticker is very important, and it will go on the bottom right. This is really important for two reasons. Number one, we can then find out where the referral came from, and secondly, that the pharmacy is remunerated accordingly. I wish you all the best, and for any queries or concerns, please give me a call or drop me an email.